Hey guys, this is part 2 with Dr. Ethan Weiss, cardiologist and professor of medicine at UCSF, and someone who's been on a low-carb diet for almost 5 years. So we're going to quickly recap what we talked about last week, the conclusions on cholesterol, saturated fat, and low-carb diets, because a lot of you guys asked for a quick summary, and then we'll look at what Ethan eats on a regular basis, which is a really interesting example of someone on a low-carb diet who is also a heart health professional. So in our conversation last week, a common theme in Ethan's answers was ApoB, which for people who are new to this, fats like cholesterol and triglycerides travel around in our bloodstream, in our plasma, inside these tiny cargo ships called lipoproteins. And some of those can cause problems if there are too many of them. They lodge themselves into the artery wall, and that's what we call plaque. So ApoB is a blood test that gives us a count of the number of those problematic lipoproteins. So for example, I asked Ethan about this idea that high cholesterol is okay as long as it's in the background of a low-carb diet. And his answer was essentially that he goes by ApoB. Because multiple lines of evidence have consistently tied it to cardiovascular disease, robustly in randomized controlled trials, genetics, etc., in every context that's been tested to date. If an exception pops up one day, it would need to be demonstrated, and until it is, he basically treats any elevation of ApoB the exact same, regardless of which diet the patient happens to be on. Very similar for this other idea that high cholesterol is okay as long as HDL cholesterol is also high and triglycerides are low. I asked Ethan about that. His answer was also that he boils it down to, what's your ApoB? He also said that HDL cholesterol is a pretty good marker of risk populationally, but probably not a mediator, probably not a cause of risk. So there's no point trying to change it directly. Now, a lot of viewers asked, how can that be? How can something be a marker and not cause disease directly? The best example I can give you is carrying around a lighter in your pocket. It's probably a decent populational marker of lung cancer. People who carry a lighter in their pocket everywhere probably have a higher risk of lung cancer than people who don't. But the lighter, carrying around the lighter itself doesn't cause cancer, right? Similar with HDL cholesterol. It can reflect a number of risk factors, but changing HDL cholesterol directly doesn't seem to provide any benefit. As for triglycerides, they also appear to be mainly a reflection of the lipoproteins that carry them, which are a subset of the ApoB carrying lipoproteins. So Ethan said the simplest way to think about it all is, what's your ApoB? Now, interestingly, a brand new trial that just came out today looked at thousands of patients who had their triglycerides lowered with a drug called the fibrate, and lowering triglycerides by about 25 to 30% without changing ApoB, the total number of problem lipoproteins of those cargo ships, didn't have a significant effect on the risk of cardiovascular disease. So this adds to the picture that targeting triglycerides directly, trying to get that metric lower or better, may not help much for heart disease. The goal is to actually get the lipoproteins themselves, the ApoB, that key number, in the healthy range. Ethan had an identical answer when I asked him about saturated fat, the intake of saturated fat, and whether a high intake is a problem on a low-carb diet. Ethan's take was that saturated fat has been demonstrated to raise ApoB, so he basically looks at ApoB. If it looks really good, and he gave the example of 60 milligrams per deciliter as a reference range, then he's not as worried if the patient is eating a bit more saturated fat. But if ApoB is high, then he does recommend moderating it. We also talked about the calcium score, the calcium scans. And Ethan said that the score rises later in life. It's kind of a late marker of disease. For that reason, having a calcium score of 0 early in life at a young age, say 30 or 40, doesn't tell us much because that's kind of the norm at that age. On the other hand, for somebody older, say maybe 60 or older, then that is meaningful if they have a calcium score of 0, because it does suggest good news. Either the person has low susceptibility to the disease, or maybe they weren't exposed to the risk factor. Either way, they seem to be doing pretty well for their age. On the other hand, for a younger person who has a high calcium score, that's a concern because it's unusual. And by the same token, a calcium scan is not a very good test of whether my cholesterol levels, especially if I've only had high cholesterol for a few years, of whether that's causing plaque to grow in my arteries or not, because calcification shows up later. It's a marker of an advanced stage of the disease. And we also touched on statins briefly and how they can raise the calcium score at the same time as they lower risk. They lower heart attacks and strokes. So a lot of viewers asked about that. And statins have a plaque stabilization effect. And the calcification may be part of that, maybe part of that repair or stabilization process. We have a whole video all on the calcium scan coming up soon. It's in the works, so stay tuned for that. And finally, we talked about this idea that ApoB lipoproteins in and of themselves are harmless. It's only if they are oxidized and circulating in this oxidized form that it's a problem. And Ethan's answer was that he thinks trying to measure the concentration of oxidized lipoproteins in the plasma in circulation and trying to change that metric is a distraction because the best tests to date have not shown a benefit for cardiovascular risk. Plus, if we keep ApoB in the healthy range, the total number of those problematic lipoproteins in the healthy range, their concentration is lower and they're less likely to get oxidized anyway. Future data may change that, of course, that's always the case, but right now, that's what the strongest data indicates. So that was last week's video. Let me know if that summary helps. Don't worry if not everything is 100% clear in your mind. Let me know if you have other questions below, but these are very frequently asked questions. So all of this is going to come up again in the future for sure. Now let's look at the second part of our conversation where I asked Ethan what he eats and he shared it with us. Bear in mind, this isn't medical advice. It's not imposing on you what you have to do. It's just an example of how someone does it.
What I'm eating is like a ton of vegetables and a ton of fish. I probably have 12 or 13 servings of salmon a week. And I probably should have my mercury tested.
Okay, I was going to ask exactly that.
Yeah. I try to make sure that there's like reasonable mercury testing in what I'm eating. And I try not to eat a lot of tuna or other, sort of bottom dwelling fish that would probably have a lot more mercury in them. So
yeah. Tell me more about the details of, on one side, the diet you eat, and then the diet that you recommend. You talk about your patient with your patients about how to eat, and you give dietary advice as well on low carb diets that are more.
I give very scant dietary advice to my patients. For a while, I felt uncomfortable doing it because I had this conflict, because I had this company, and I really just didn't want to be selling my own stuff to them. I want them to be confident and comfortable that I'm giving them the best advice, independent of what might be better for me financially. But even now that I'm not really as involved with that company, I still, I give kind of high level advice where I will say that I think if you got a bunch of these diet tribalists in the same room, that you might find like 3 or 4 things that they could agree on. And that those are the things that I would sort of emphasize to them. So those would be the obvious stuff, like avoiding highly processed foods. Like if you take a bag of Doritos that's sitting in the kitchen across from my desk here at work and look at what's in it, I don't recognize 90% of the ingredients. And you also understand that bag of Doritos was engineered to like be incredibly tasty and addictive. And it's also the kind of thing, like if I came back here in 25 years and opened that bag of Doritos, it would probably still taste good, which is kind of right, just defies logic to some extent. So I don't know. I mean, I think it's probably too controversial that highly or ultra processed foods are probably things to avoid. Does it mean never? No, nothing is never. Like that's an absurd concept. So that one, I think, avoiding a lot of added sugar. I don't eat any added sugar, but like avoiding added sugar is probably a reasonable thing. Mostly, again, if it's a birthday party, you want to go out and have a piece of birthday cake, have a piece of birthday cake. But I think we add a lot of sugar to our food, and it's probably unnecessary. I think sugar sweetened beverages are a complete and total waste. Like I think it was Malcolm Gladwell who talks about consuming 5 different liquids or 4 different liquids: coffee, tea, water, and wine. All right. And for me, like I'll have an occasional tequila. So like, that's it. I don't really have the need for anything else. Occasionally I'll have a flavored water, but that's kind of it. And then the last thing is, and this is something I do talk about with my patients, I think there's probably good evidence, and this probably speaks to all of this stuff, particularly the processed food part, that the more meals that you make yourself at home or that somebody who lives with you makes versus the number of meals that you're either ordering or going out and buying somewhere at a restaurant or fast food or whatever it is, I think that probably has a bigger impact on health than almost anything. So I think, if you can find, and it's not easy, although it's not nearly as hard as people think, to be able to make your own meals. I've been making one of the biggest changes I made in my life when I started doing low carb was that I started making and bringing a salad to work every day in this like stupid little container that I still have, the same one. And I fill this thing up with a bunch of vegetables and some nuts and like some salmon or whatever it is, or whatever leftover protein I have from the night before. And I've been doing that, and it takes me about like 6 minutes in the morning to do it. It's really not a huge deal. And what it means is I'm not going out to like a food truck or ordering from Uber Eats or eating some crap here in the kitchen. And I do think that's had a meaningful impact on my health.
No, I couldn't agree more. Vegetables, do you avoid starchy vegetables? I would imagine it's low on that and more maybe the greens.
I mean, I wouldn't say I don't eat them routinely like I would eat non-starchy vegetables, but my position on them has changed a lot. Like I said, I made sweet potatoes last night. Yeah. I had them again for lunch this, in my salad. I just threw them in my salad because it looked like it'd be fun to throw them in there. So I don't avoid them completely, but it's not a regular thing for me. Mostly non-starchy.
So like green, what are some vegetables that you might have on a typical day?
I mean, my typical vegetables are celery, cucumber, some greens, like, mostly arugula, anything that's around if I can find it. But those are the sort of typical ones that I'll like put in a salad every day. We will roast cauliflower, broccoli almost every night, asparagus. Those are the regulars.
That makes sense. And what about oil? What are your thoughts on oil?
I use 2 oils. I use olive oil for salads and for dressings and for things that require taste. And I use avocado oil for cooking. And that's kind of it. And I use it abundantly. I don't have any concern over having more of it. In fact, it's probably where I get a big chunk of my daily intake of dietary fat. I think olive oil is nirvana. It's perfect. I think it's an incredibly healthy food. There probably as much evidence for the health benefits of olive oil as there is for almost any other food or food-like thing that we have in nutrition science. And so I think olive oil is the best.
And you mentioned nuts, you mentioned fatty fish, avocados and things like that, olives.
Avocado every day, olives pretty much every day in my salad.
Okay, that makes sense.
I have half an avocado in my salad every day.
And what's your stance on the more saturated, concentrated saturated fat source like butter, fatty meats, coconut oil, palm oil, things like that?
I don't ever use coconut oil or palm oil just because, again, I use for cooking at high heat, I use avocado oil. I'll occasionally, like if I'm making an omelet or something, and by the way, I eat eggs. I don't eat a ton of eggs, but I eat eggs. But if I'm making an omelet, for flavor, I might throw a little, tablespoon of butter in. Like, it's. I don't completely avoid it, but I hardly ever use it. And obviously, if like a recipe called for it, I would use it, but there aren't that many recipes that do.
But it's not a staple, but it's something that you don't avoid it religiously. Yeah.
No.
Read it. What about salt?
So for salt, I use the same logic that I use for ApoB and food. And that is that if you can eat a lot of salt and it doesn't have an impact on your blood pressure, then no problem. And so I happen to be one of those lucky people. I have low blood pressure and I'm not eating like, I don't know, 10 grams of salt a day, but I'm probably having 3 to 5.
That's of salt. That's pretty low.
It's probably pretty low, isn't it?
Yeah, that's about half as sodium. So that would be 1.5 to 2.5. That's like under the recommendations. Like that's like the safe range.
Oh, well, then maybe I'm not having as much. I mean, I'm pretty routine. Like I don't have any salt in the morning. My breakfast is the same every day. It's I have this like plant-based yogurt that I really, really like. And then I throw berries in there and avocado, walnuts and some sunflower seeds. It's super boring. Like I have the same exact thing and a cup of coffee. So I don't have any, I mean, I don't think there's much sodium in the yogurt. There might be a little bit, but I don't have a lot. And then for lunch, I salt my salad. And then whatever I'm making for dinner, I salt it generously.
So that's Ethan's example. That's what he does. Now, for people who may be worried about the heavy metal contamination, the PCBs, Ethan brought up the issue himself, but we have a whole video going over that in some detail, going over the evidence, going over the safe ranges and all that. Also, I realize some of these foods may not be the cheapest. There's just an example. We can take the logic and play around with it. There's plenty of room for flexibility. So those are some practical examples of how to do a low carb diet while at the same time minding our heart health. A lot of you guys ask if low carb diets automatically mean high cholesterol. Are we forced to choose between being diabetic and having high ApoB? Of course not. This isn't Sophie's choice. Most of us can have it all at the same time, as long as there isn't some genetic limitation underlying, right? And a healthy lifestyle should optimize every aspect of health. That should be the expectation. We don't have to settle with our health. All right? Take care. I'll see you next week.